I've been informed we are good to go, so I apologize for that delay. I'll just begin my opening remarks again, given the announcement of our new general manager. So last week, the city manager, Wendy Stephenson, announced that the new general manager of Emergency and Protective Services is Ryan Perreault, who is familiar with this committee and has worked on a number of significant files with us. Mr. Perreault will step into this role when the executive recruitment process for a new permanent GM of the new Strategic Initiatives Department is complete, as Ryan is currently the interim GM there. And today we have Fire Chief Paul Hutt acting as interim GM of Emergency and Protective Services. On today's agenda, we have two annual reports. First, Chief Hutt will present on the 2023 Ottawa Fire Services Annual Report. Then Chief Boyer will present on the 2023 Ottawa Paramedic Services Annual Report. In 2023, staff from both of these services faced increased growth in calls and responses, supported several major emergencies, and dealt with numerous difficult situations. Before I turn it over for their presentations, I do want to thank all staff and personnel of both of these services for their hard work and dedication, in particular in 2023. Okay, are there any declarations of interest? Seeing none, next item is confirmation of minutes from our meeting on 16th of May, 2024. Are these minutes confirmed? Confirmed, thank you. As I said, we have two annual report updates, so we'll get right into them. The first will be Ottawa Fire Services 2023 Annual Report. We do have one delegation, so before we get to questions from committee members after the presentation, we'll hear the delegation. So interim GM and Fire Chief Paul Hutt, over to you.
Thank you, Chair. I'll just wait for the presentation to load. Good afternoon, Chair. Thank you for the opportunity to present the 2023 Fire Service Annual Report. I think, yeah, there we go. That's the second presentation. Perfect. Thank you very much. The objectives of the presentation today, we'll talk about the OFS annual report content, OFS service review, service delivery model, response standards, performance, critical responses in 2023, and a look back and a look forward. Next slide, please. Thank you. This report outlines the Ottawa Fire Services activity in 2023 and the information about fire protection and prevention services, fire service delivery model, recruit, hiring, equity, diversity, inclusion, Ottawa Fire Service response standards, performance in 2023, key responses, and strategic initiatives and investment strategies moving forward. Next slide, please. The report highlights Ottawa Fire Services and programs. Notable among these are the Fire Investigation Division. In 2023, this division investigated 279 fires that exceeded the fire loss of 550,000 or resulted in injuries or death as required by the Ontario Fire Marshal's Office.
Enquête sur les incendies, collecter, analyse et communication des données par les enquêteurs sur les incendies. Enquête sur les dégâts par le feu et les sinistres de plus de 50 000 $ ou ayant entraîné des blessures ou des décès. Enquête sur 279 incendies en 2023.
The Fire Safety conducts extensive safety research, promotes culture and learning and safety within the Ottawa Fire Service, provides safety at emergency scenes, and develops protocols and procedures to keep fire safe, firefighters and the public safe. Next slide, please. The Ottawa Fire Service Training Centre is a provincially recognized training provider for the Ontario Fire Marshal's Office, and Ottawa Fire Service responds in partners across Eastern Ontario. Safety Division provides a culture of safety, learning, and ensures a safe on-site during critical emergencies. The community standards and communications engaged with the community through proactive measures to reduce fire risk, deliver fire safety education, fire code enforcement, and conducts fire code compliance inspections. Ottawa Fire Service operations provide fire rescue, tiered medical response, incident management. Special operations include water and ice, trench and collapse, confined space, high-angle rescue, urban search and rescue, hazmat, and the growing area of fire support to partners in demonstrations in the city. Administrative and operational support is managed OFS scheduling, purchasing, facility, and budget oversight. Next slide, please. Ottawa Fire Service is committed to building a diverse and inclusive workforce that reflects the community it serves. The retooled recruitment and hiring process emphasizes equity, diversity, and inclusions, attracts candidates from a variety of backgrounds and experiences. Ottawa Fire Services fosters a workplace where everyone feels valued and respected. In 2023, the recruit class was 19% women and 17% individuals identified as being from diverse backgrounds and groups. Next slide, please. In addition to the recruitment program, Ottawa Fire Service is promoting equity and inclusion through several key initiatives. Camp Fit is a program designed to encourage young women to consider careers in firefighting, providing hands-on experience and mentorship for female firefighters.
Les femmes pompières en formation, plus de détails sur nos camps, une autonomisation des jeunes femmes, renversement des obstacles, promotion de la diversité et de l'inclusion, engagement en matière d'équité et de diversité, nomination au prix pour l'équité et la diversité de la ville, 320 participants depuis 2010, 8 pompiers professionnels au sein de notre service, 12 pompiers professionnels dans les autres services des incendies et 40 pompiers bénévoles.
Next slide, please. The Ottawa Fire Service's ambassador programs ensures firefighters to build relationships and foster trust with diverse communities. Through this program, firefighters participate in a variety of community events, educational sessions, outreach activities to connect with residents and address their concerns. The program aims to break down barriers and ensure that all community members feel represented and supported by the fire service. By promoting open communication and understanding, the Ottawa Fire Service Ambassador Program helps create a more inclusive environment where diverse voices are heard and valued. Additionally, the Ottawa Fire Service Venture Program offers youth the opportunity to explore firefighting as a potential career, emphasizing leadership, teamwork, and community service. These initiatives reflect Ottawa Fire Service's commitment to create a more diverse and inclusive service. Next slide, please. So the chart before you illustrates our response standards for 2023. We have an urban response area, we have rural response areas, and then we also have urban effective response forces areas, force times, and rural effective response force times. And just so I can share with committee, so when we say first on scene, so from the time that the call is received from 911 to our communication center is from that time when the first apparatus arrives on scene. You can see for an urban area that the standard is just over 7 minutes, 7 minutes 5 seconds, and our standard was of having a first truck or apparatus on scene was 6 minutes and 49 seconds. On the rural side, we have a standard of 16 minutes and 52, and you can see we were significantly lower. We had, on average, an apparatus on scene within 12 minutes and 36 seconds. When we talk about effective response force, when we look at how many firefighters are required to assemble for a moderate situation, that's 16 firefighters. So within our standard in an urban area is to have 16 firefighters on scene from the time of call. The standard is 12 minutes, and we're definitely meeting that standard by on an average of 8 minutes and 26 seconds. And on the rural side, for having 16 firefighters assembled, the standard is 22:39, and we're meeting that standard as well on average at 17:04. Just one item to note for committee. We are in the middle, and committee's aware of this, transitioning Stittsville, where they are moving from a rural designation to an urban designation. So we're in the process of making modifications to that station. So that is, there'll be some changes to the Stittsville Station 81 area. Next slide, please. Call and incident volumes have increased, but OFS continue to meet the time standards in most categories for 2023. Just for an example, our communications center, 106,000 calls, that's an increase of 7%. Apparatus responses were over 85,000 apparatus responses. There's an increase of 15%. And false alarms, we're continue to see an increase of 14% on the false alarms, but as committee is aware, starting July 1st, we're moving forward with our false alarm strategy. Since the passing of that, we've been doing an educational outreach program, and we go live as of July 1st of 2024 with the false alarm strategy. So look forward to report back to committee on that. Next slide, please. In 2023, the Ottawa Fire Service continued to respond to complex and severe incidences. This report will highlight responses to the February Orleans explosion, the ice storm and associated power outages and floods, the Barrhaven tornado that was in July of 2023, the August rainstorm associated flooding and power outages, and then we also had the Finley Creek tornado. The October General Hospital fire and power outage presented yet another significant challenge. In addition, the Ottawa Fire Service is experiencing an increase in size and frequency of protests in the downtown area, which requires a response from the Ottawa Fire Service.
Intervention critique en 2023, unité de soins intensifs néonatales de l'hôpital d'Ottawa, c'était le 17 octobre 2023.
Next slide, please. Next slide. Thank you. In 2023, the Ottawa Fire Service began the process to be reaccredited with the Commission of Fire Accreditation International, and as such, completed a new standards of cover document which will form part of our certification. In 2025, we'll be moving forward with a station location study before committee. So in 2023, we've been working on that project. Also in 2023, Ottawa Fire Service completed construction of its new Station 45 serving West Carleton March and Canada North. As you know, the Ottawa Fire Service has undertaken several interim initiatives to support ongoing training and development of staff because of our training center, and we continue to work with our city partners to find a sustainable model for our training center. Next slide, please. As we look ahead, staff have begun planning for the expansion of Station 81 at Stittsville Station 81, which will become a composite station, adding 4 career members to each of the platoons, which will be augmented with volunteer firefighters. Ottawa Fire Service has found temporary funding for a mental health resource and directed to look into making this permanent come 2025. And as I mentioned previously, Ottawa Fire Service will be conducting a new station location study, which will inform the decisions of us moving forward from a deployment and a resourcing perspective. I want to thank committee. This does conclude my presentation, but happy to answer any questions if there are.
Thank you very much, Chief. We will get to questions in a second. We do have one delegation who I'll call upon at this time, and that's Ms. Calla Barnett. Ms. Barnett joining us virtually.
Yes, I'm here. Apologies. The switchover takes some time. Thank you.
No problem. We can see you and welcome, and you have 5 minutes.
All right. Thank you very much, and good afternoon, everyone. I appreciate the opportunity to delegate today. I'm the vice chair of Action Sandy Hill, the community association. I'm also a member of the Sandy Hill Community Liaison Committee. I'm grateful to both OFS and OPS for their service, and I don't have a lot of time, so I can't do that well, but it is an ever-present gratitude as a resident in the city. I'd like to address the annual report and risk assessment that was provided by Fire Services. I have concerns about the presentation and the general understanding of risks for OFS in urban areas. I will explain some of the issues I see and then focus on what that might mean for residents and for people with lived experiences in this space and in my ward. So my local fire station is Station 13. Anyone who looked at those numbers knows that it's the busiest fire station in the whole city. At the same time, there's also been a significant increase in medical calls, almost 25% since last year. And I'm confident, assuming that the stations in District 1, including Station 13, are seeing the largest proportion of that increase. I'm making an assumption here because that information wasn't available, but the impact of the toxic drug supply and the overconcentration of social services in this area are not identified as risks. And I believe they are risks in the context of medical response. These emissions lead me to question whether or not Station 13 and the District 1 fire stations will receive adequate funding to respond to those things, because I know risk assessment impacts funding. And so on page 113, there's a paragraph called transitory risk, a section, and then a paragraph on the unhoused population. There's multiple issues for me in the way that risks are identified in that paragraph, as well as there's some stigmatizing language being used. And so I'm going to address those things. The language, though, is so stigmatizing. I did expect other groups to be here because they vilify residents for saying things like that. And they like to go to OPS, like police services meetings, and address that, but they're not here. So that said, the first and most stigmatizing thing that occurs in the report is that the unhoused population is actually identified as a risk. And they're not a risk, they're part of the population of service. But the paragraph is almost exclusively focused on encampments as a risk. And encampments are a risk. But only encampments in hard to reach areas are identified as risks here. And so there's just a few issues with that. Specifically that there are plenty of pop-up encampments on schoolyards, on sidewalks, on private property, and in parks in Ward 12 and probably in other urban wards that could also become risks for fire or for medical support. Also, there's like one sentence in there that suddenly talks about these people standing on meridians asking cars for money. But those people are not all necessarily suffering from homelessness or unhoused. And it's like a whole different risk. That's a like risk to being able to respond or people getting hurt. It's not an encampment risk. And then there's some of the language being used. Drug addiction, for example, should be called substance use disorder. Drug abuse should be substance use. Additionally, it's not substance use that drives people out of shelters, as it said. Oh, I didn't note the page number. I'm sorry, but it's earlier in the report. But
1 minute left. 1 minute.
Thank you. But it is actually the behavior of those people that drives other people out of shelters, not the drug use itself, not the substance use itself. And the worst part about that language is that if the city is perpetuating stigmatizing language, it puts others who don't know better yet at risk of being abused by the service providers and advocates who constantly abuse residents who use the wrong language. And then there's finally other risks are like the fires that we have. We have fires caused by warming fires. We've had arson in our area. It's consistent, it's expected, and it should be an identified risk, especially for Station 13. And so what I'm really would like is to see this reevaluated in a different way and to understand the risks according to various different things that we're facing as a result of the overconcentration of social services and the toxic drug supply. I'll be like 30 seconds.
Yeah, if I could ask you just to wrap up, and then we have at least one question for you from a committee member.
Oh, wonderful. Thank you. So this is what I was going to say is urban encampments, rural, remote, and invisible encampments, warming fires, vacant and or other problematic properties, toxic drug supply, and the overconcentration of social services. We're afraid here, and we need to have the risks identified properly.
Thank you, Ms. Barnett, for your delegation. I appreciate it. Points that you've raised. Councillor Devine, you have your hand up. Do you have a question for this delegate? You don't. Okay. Any questions? Okay, none at this time, Ms. Barnett. I know you'll be speaking on the next report, so we'll see you in a few minutes. Thank you for your delegation.
Thank you.
Okay, colleagues, it's time, at this time, if you have questions for the fire chief, Councillor Devine.
Hello, Chief. Thank you very much for the report. I just had a few very technical questions based on the statistics in the report. So one thing I noticed, there was an increase in Ottawa Fire Service medical calls in the past year. Is it fair to assume that the reason for those increased medical calls is related possibly to challenges being experienced by paramedic services?
Chair, Councillor, thank you for that question. Towards the end of 2023, we re-looked at our medical tiered response agreement in conjunction with Ottawa Paramedic Services, and there was opportunities where fire services could assist with less acute calls like lift assists, and that is the reason for that increase of calls.
Well, thank you. And as I've mentioned before, any innovation, whether from Ottawa Fire or Ottawa Paramedic, to assist with the challenges that paramedics are facing, I appreciate that. So thank you for that. Another question. So I noticed that in your posted response times, the response times are categorized based on the classification of fire. And I noticed that, for example, our response time for the maximum risk fire is the quickest, fastest response time, as I would hope and assume. But I also noticed that we have a faster response time for moderate risk fires than high risk fires, which I just found not off by a whole lot, less than, I think, a 30-second differential. But I did find it odd that our response times for moderate risk fires was faster than high risk fires. Is there a specific reason for that?
Chair, no specific reason. It could have been a number of variations where the call was, time of day, construction activities, if there was any delays. Also keep in mind when we have a high risk, a moderate requires an effective response force of 16 firefighters on scene. When you get to a higher risk, you require more firefighters to assemble to mitigate that situation.
In fact, my staff member who brought the question to my attention assumed rightly that it was quite likely due to the amount of resources I have to allocate. My last question, I was looking at one table. There's a significant increase in the miscellaneous category. Is that an anomaly or a trend? Can you expand on why there was a 30% increase in the miscellaneous category?
Chair, the miscellaneous category could be public assist calls, helping other agencies such as police. It is kind of a catch-all. There are no anomalies, but it's a category that it's normally assisting the public with certain aspects, or we're getting a request from police services for intervention.
Great. Thank you very much, Chief. Thank you, Chair.
Thank you, Councillor. Conseiller Plante.
Oui, merci beaucoup. First, obviously, thank you for the work you do, especially in our downtown core. I know it's been challenging, and I know you've picked up a lot where the paramedics are not able to respond downtown. I see you guys go out for those overdose calls. I live around the corner from Station 13, so we physically hear it as well, the calls and frequency. So merci beaucoup for that. I do want to know, though, when there is a vacant property and then you attend to a fire there, who pays that bill?
Chair, so when there is a property that is vacant, again, it's a collaborative approach, fire services. So we have authority on scene to put out the fire, mitigate the fire. So we have care and control at that point. When we leave, we have to at least render it safe, and rendering it safe could either have it boarded up or fenced off. When it comes to the removal of buildings, that's where we have to get involved with our colleagues in property standards and other divisions, building code services, to help assist with that. So from a fire service perspective, the property has to be left in a safe condition,
Right.
which the minimum requirement is ensuring that it's not accessible to the public. So it's either fenced or security watched or boarded up.
So who gets that bill?
So so we do, and actually under the regulating and establishing bylaw that we recently approved, it gives us the authority to charge back, and also the fees and services bylaw within the fire services. So we do have the option to recoup costs for boarding up and fencing. If either the property owner or the insurance company, if they don't pay for it, then it gets added to municipal taxes.
Okay. And then what about an encampment? I'm assuming taxpayers take on any costs for fires at encampments?
So for encampment, there really isn't encampments are often temporary shelters. They're other than working with city facilities if there was a fire, if it had to be cleaned up to render it safe. But end of the day, we have not cost recovered for an encampment to date.
Okay. Okay, I'll follow up on email. Merci beaucoup.
Thank you, Councillor. Councillor Kavanaugh and then Johnson.
Thank you, Chair. Thank you, Chief, very much for all your work for you and your team. Appreciate it. I'm going to ask about water rescues, because that's something that's very big in our area. And the concern that I hear is, do you have enough to get there on time? You've been very successful, but obviously there's always been some anomalies that just can't be helped. And you have the station on Croydon, which is fairly close to Britannia area where most of the mishaps are occurring. Do you feel you have enough? Because it's been pointed out maybe you should be closer to water during the summer months when, given all the incidents that are happening.
Mr. Chair, thank you for that question. And yes, we've had two very tragic incidences recently, and it is definitely top of mind. From an Ottawa Fire Service response perspective, we do have adequate resources that are in the proper locations to respond. The other thing to keep in mind as well, we do work very closely with Gatineau as well, which they have a water rescue team, and we often collaborate and consult each other when we're responding. So not only do we have adequate resources within Ottawa Fire Service, we also have a neighboring department that responds quite often with us in those areas.
That's good to know, and obviously you have other areas. Britannia is the one that's top of mind, of course, to me, but you have Petrie Island and Mooney's Bay, but with Britannia, it's the issue of the rapids where people just end up there without realizing the dangers. So I don't know if there's any special emphasis on that factor.
Thank you for that question. Our teams are extremely trained for swift water rescue. We have the proper boats and equipment to navigate the very difficult waters. From a communication perspective, our public information officer is constantly reminding the public, and quite often what happens is somebody gets themselves in a situation that the current starts taking them away. So it's that education piece that we need to continue to remind our residents and visitors that to be aware of their surroundings, and if they haven't experienced an area of water, chances are they should stay off it if they don't have experience. So.
Thank you very much, and of course, education, prevention is the first key. Thank you so much.
Thank you, Councillor. Councillor Johnson.
Thank you very much, Chair. A couple unrelated questions, but first I'd like to thank the delegation for their sensitivity to language being used in reports. I think that's good information and bring back to the Central Corporate Communications PIMR office to see if we've got any standards there that can be applied across departments, so that's great. So the first one was, firstly, just to say thank you so much for the, the increased emphasis on EDI, or, sort of expanding on that section of this annual report. I know we had talked about that last year, and there's evidence of that this year, so I'm, really pleased to see that commitment. We just wanted to understand if you could confirm that the Count Me In questionnaire is now being applied in the application to rural volunteer firefighters as well as, I can see you nodding.
Chair, thank you for that question. Yes, it is. Actually, that was good insight from our previous conversation, and it is applied both on the rural side as well as our rural side as well.
That's wonderful. I'm so glad to hear that. And then the other one was with respect to, increased calls due to intensification. Do you anticipate in future years there's going to be an increased financial pressure on your apparatus, the actual, wheels on the ground that you need to respond? Because certainly in our wards, we're going to be seeing more high-rise development than ever before.
Thank you. In my report, I referenced our accreditation, and we constantly evaluate that information and that data because some of the challenges we're seeing now, it's vertical now, it's going up, right? So when you talk about on scene, if you're going up 5, 6, 7, 10 stories, that's adding to the time as well. So when we take a look at our numbers, all those factors are taken into consideration. And we do, when we come forward with our station location study, it's really going to share a lot of that more in-depth data as to, are we meeting the standards? Where do we see this intensification? Because we might be meeting our standards today, but we need to plan for 5, 10, 15 years down the road. So to your point, as we see the intensification, that's where the station location study and this certification, that third-party certification that we have, analyzes all that information and that data.
Okay, that's wonderful. So you feel satisfied that within this station location study, you'll have the forecasting ability and expertise that you need across your departments?
Yes, thank you. Yes, I do. It's quite in depth, working very closely with the city planning department, where the growth is, what the intensification, what it looks like. And there's other factors as well, other than just intensifications. It's, road networking and the systems. And so there's a whole bunch of other elements, high risk facilities versus lower risk facilities. So that is all taken into consideration when we're looking at that evaluation.
Thank you, Councillor. I do note, Councillor Devine and Kavanagh, your hands are up, but do you have any further questions? No, you do? Go ahead.
Thank you very much, and again, thank you, Chief. In terms of generators, we've talked about this at large, and we've had a motion and direction to check on which buildings have generators for power outages. I just wanted to thank you for your taking this on, and what can we do as councillors to help in identifying buildings that do not have generators that will be particularly problematic if there's prolonged outages?
Mr. Chair, thank you for that question. I think as we stated that document where it was 6 stories and higher, where we identified what high rises had backup generators, was it for life fire safety, or was it for backup for elevators, etc. That's work in progress. So and it is a living document. So as we grow and we develop and we see high rises, or if there's a specific high rise within your ward that you are concerned about, it's as simple as sending us an email. We'll just make a note of it. There's opportunities for us to put notes on our system for specific addresses. And if we think it's going to help our residents or in the future, then just please send us an email, and we'll keep that list up to date as much as we can.
I appreciate, and that's for all of us as councillors, particularly in the urban areas. Thank you.
Thank you, Councillor. Councillor Luloff, you're next.
Thank you very much. And thank you, Chief Hutt, for another annual report and for another successful year with the Ottawa Fire Service. I'm very lucky to be able to host many events held by the Ottawa Fire Service, especially 2 weekends ago at Cumberland Village. We had our rural firefighters out to do Firefighter Day. That sort of engagement means a lot, and the education that our community gets out of those opportunities is A1. So thank you very much to everybody who came out and participated in that. It was interesting to be able to see the equipment being used as some old wrecked cars came in and were tipped up on their side, and they did demonstrations with some of the equipment, some of the water games to show just how much pressure it takes to be able to put out a fire, and giving kids and families an opportunity to try out equipment and to understand the risks that the members face, I think is very important. So thank you very much. The public engagement that happens at Ottawa Fire Services is second to none. Very proud of the work that you do, and appreciate when describing risks in your report that you're using precise language. I think that that's important when we're dealing with matters of life and death. Thank you.
Thank you, Councillor, for those kind words. I just wanted to add my appreciation for the fire service, all individuals who serve not only as firefighters, but the support staff behind the scenes that keep the service running is fantastic. And it's a lot more than fighting fires. Our firefighters respond to motor vehicle accidents, natural disasters. We've heard water rescue all through the summer and spring. It seems they all come from Bay Ward, but that's certainly where a lot of our the sailing club exists and the rapids. But rural terrain rescue, hazmat issues, and the outreach and prevention and the education component is bar none. Certainly, it only gets better over the years that I've been here. It's been a strong unit, but certainly the leadership you have is very, very good, and it's so important to reach out to the public and reinforce issues of fire prevention. So shout out to everyone who serves in the fire service, and we appreciate the good work under your leadership, Chief. Thank you. So colleagues, before us is the 2023 annual report of the Ottawa Fire Service. Is this item received? That's received. Thank you very much. The next item on our agenda is the Ottawa Paramedic Service 2023 annual report. And I'm not sure, Acting GM, if you have any introductory comments first.
Thank you, Mr. Chair. Just before I hand it over to Chief Poirier, I do just want to acknowledge the amazing work that our Ottawa Paramedic Service does. You know, there's many challenges day in and day out, and you know, Councillor Plante talked about some of the challenges that we see in the downtown area. And I just want to commend them for their work that they do each and every day, and they rise to they rise to that challenge every day. So I'll pass it over to my good colleague.
Thank you, Chief Hutt. Bonjour, le Président et les conseillers et conseillères. Je suis fier de vous présenter notre rapport annuel au service des paramédics. Next slide, please. Notre présentation du service. On est financé à 50-50 par la Ville et par le gouvernement provincial. On sert plus d'1 million de résidents. Puis, vous savez bien, notre superficie de presque 3000 km². Notre centre de répartition, c'est un peu différent. C'est financé 100% par le gouvernement provincial. Puis, on reçoit les appels d'urgence faits au 911 et assure la répartition des ressources paramédicales dans l'est de l'Ontario sur une superficie de 10 000 km. Alors, notre centre de répartition prend soin ou donner service à Hawkesbury, puis à Cornwall, puis en ces lieux-là. La prochaine. Next slide. Juste au sujet de notre service, notre équipe est constituée des répartitrices médicales et les répartiteurs médicaux d'urgence, des techniciens en approvisionnement, des formateurs, des paramédics et des employés de soutien. Nos interventions médicales d'urgence sont 24/7 sur 365 et les soins de santé à domicile et en lieu communautaire grâce à des modèles de soins non traditionnels. Puis, on parle toujours de nos équipes. On a des paramédics communautaires, on a une équipe d'intervention pour le bien-être mental, une unité de paramédics à vélo, des équipes de paramédics nautiques, unité de soutien des paramédics, unité des paramédics tactiques et aussi une équipe d'éducation publique. À la prochaine. Just to move a little bit more into the report and the content of the report, response time performance is an important piece of our service. And as much as last year was not good news, this year is still not perfect, but we do demonstrate a lot of improvement. And that's particularly notable in the context that committee and council supported the additional paramedics last year. And my belief is that the support that committee and council has provided to this, to our service has started to demonstrate the improvement in our performance. The most important performance elements, the sudden cardiac arrest, CTAS-1 and CTAS-2s, we're still not meeting the performance standard. I'm optimistic that with the introduction of MPDS, the new dispatch support tool, decision support tool, that will continue to show improvement. It is a year of optimism. I recognize very much that we're not there, but we're on the right track moving forward in terms of improving our performance time. Next slide, please. In terms of our service demand, year over year, 22 to 23 is almost 5%. And when you include the pandemic and a 10-year profile, we're about 5% a year. That's related to population growth, our aging patient demographic, increasing medically complex patients. And I've had questions about what are pre-existing issues in the healthcare system, but it has everything to do with lack of family physicians, lack of hospital beds, a shortage of nurses, a surgical backlog, problems in the emergency department. All of those elements contribute to, at the end of the day, people call 911 because they need help. And often we are the source or the last resort for those individuals. Next slide, please. Just to put our service demand in, an important element is offload delay. That is where we're unable to transfer the care of our patient from our staff to hospital staff. The target is 30 minutes at the 90th percentile. We've had that standard for several years, and for several years, hospitals have been unable to achieve that. There was a significant increase last year. The good part for us is that several of the mitigation efforts that the Ottawa Paramedic Services put in place have actually reduced the level of zero events, in spite of the fact that the actual offload delay numbers have worsened. And this is still significant. The 90th percentile went from 157 minutes to 162 minutes. And this truly is a problem for our service, but also for the provincial government, who really has ownership of the hospitals and the work they do. And from the Ottawa Paramedic Service perspective, it is time for the hospitals to improve the transfer of care from our service to their service. Next slide, please. Important just to note, all that we're trying to do, many people will say, so what are you doing in terms of your share of the problem? Offload delay, we all share a component of it, but most of it is owned by the hospitals. But here's just a short list of a number of initiatives that we've had ongoing that we've put in place over the last several years in terms of strategies that are specific to the hospitals, strategies that are actually on how we divert patients away from the hospital, and then even the fact of how we deploy our resources to support the activities that we do. And we can go to the next slide because that kind of puts a few of them in perspective. The Smart Transportation Program is where we've worked with a physician, where we call a physician and we actually do a more in-depth assessment so that we can either treat and discharge, treat and cancel a patient. And it actually takes a little bit more time, but we save time by not having to transport that patient to the hospital because we've had a consult with a physician. The Fit to Sit program, we've actually doubled the number of individuals who have gone to Fit to Sit. And that's kind of a colloquial way of saying that those patients who are lower acuity, non-life-threatening, that often when we take them to the hospital, wait the longest. The hospital is actually pretty good at taking care of somebody who is in respiratory distress or is having a heart attack. What the hospital is not good at is somebody who is maybe has an abdominal pain and it's undiagnosed as yet. And those patients will wait hours and hours and hours. And we're the individuals or the service that ends up held with that patient. So the Fit to Sit program is where we take low acuity patients and we put them in the waiting room instead of waiting with them in the hallway. And credit to the hospital, this is an agreement with the hospitals that we work together to identify those patients which can safely be put in the waiting room. So we double the number of patients we put in the waiting room. The TED program is the Targeted Engagement Diversion. It's about 7, 8, maybe 10 years that we've been engaged in this process. We've worked with the Ottawa Hospital, Ottawa Intercity Health, and the Shepherds of Good Hope. And for that patient population where they may have a substance use or substance use disorder, that those patients, by their choice, we take them to the Shepherds of Good Hope. And this is really a positive one where those individuals are often the ones who may wait a long time at the hospital. Those are the individuals who may leave against medical advice because they haven't been seen. So the TED program has been a fantastic addition. We've almost doubled the number of individuals who took there, which is a good and bad scenario. One is reflective of our society, but two is we're taking people to where they can get the service that they're asking for. The mental well-being response team, a couple of years in development. It continues to see a very positive impact on our community, and where we transport, I think, around 30% of those patients to the hospital. And that's a very good number compared to when we go to most calls, we're transporting around 70% of those patients to the hospital. So another good initiative. And then the last one is more an operational issue, but what we instituted last year in late 2022 is that we'll do a vehicle refresh at the hospital. So we actually have equipment and supply technicians who go to the hospital so that those paramedics can remain in service. So that's a few of the mitigation strategies that we put in place over the last year and over the last several years. Next slide, please. An important piece for the Ottawa Paramedic Services, looking at an improvement in our culture and the well-being of our staff. There's been a number of surveys that are done over the years. The pandemic has been, I'll say, brutal on our staff. It's been a really significant moral weight that paramedics have carried. It's been a very difficult time, and coming through that, we've recognized that our service has to do better in terms of taking care of not just the physical health of our staff, but also the mental health. So a number of initiatives, our peer support program. We've actually instituted a patient ratio protocol where we actually permit our staff to go home at the end of their shift by, at the moment, allowing crews to double up at the hospital. We just did hire in March of this year a staff psychologist, an incredibly welcome addition to our service. And we're working on an organizational culture assessment and roadmap, and I can talk more about that as well. Next slide, please. Just in terms of some of the service highlights, in terms of the staff mental health, we've had open houses for families, recognizing that families are really an important piece of the social network that supports staff in their job every day. Our public education team, which was recognized with a nomination by the City Manager's Awards of Distinction, had over 600 first aid and CPR courses last year, almost 7,000 individuals trained. And that really is an important piece of our sudden cardiac arrest. When we think of the response to sudden cardiac arrest, it's not just paramedics, but the community. It's about the individuals who work for recreation and culture at the hockey rink, and the police who may have an AED in the back of their vehicle, anybody who can help with that process. The community paramedic programs, I think today we're caring for over 7,000 individuals in our community. We're keeping them out of the hospital. Last year, we also received additional funding to double up on our neonatal transport team in support of CHEO so that we can provide a healthier service to Eastern Ontario. And annually, we have a Paramedic Awareness Week, which youth, I think 12 to 17, we provide them 1 week of training in terms of what the life of a paramedic is. Very much oversubscribed. We'll be hosting that again this year. Next slide, please. And just a few other notes. In 2023, the Mental Wellbeing Response Team did win the City Manager's Award of Distinction. We recently applied to the Ministry of Health and received permission to add Suboxone to our treatment for opioid-related calls. Just to put that in context, Narcan will reverse the effects of an opioid. Suboxone is a drug that can help bridge somebody to asking or wanting to enter into treatment. I think it's a fantastic addition to our service. With the over the last number of years, through the Ottawa Hospital, a C-spine rule was developed, and it was recognized by the Canadian Association of Emergency Physicians, particularly because this allows patients not to be, I would say, restrained. It is something that is, bit by bit, is being taken on around the world in terms of a way of dealing with individuals who have been in motor vehicle accidents, who have suffered falls. It really is a game changer in terms of treatment and care for individuals. We just a couple of weeks ago held a tactical paramedic conference at Centrum in Orleans, fantastically well subscribed, very much a pleasure, and we had individuals from across the country, and I think we had individuals from New Zealand as well attend. And lastly, the best news that we had in a while was that on April of this year, April 11th, we received our first call under the new medical priority dispatch system, which already is demonstrating some fantastic results. It's not the solution to every problem, but it is a significant improvement on the old system. So, merci, le président. Thank you to all, and I think that's my report for today. Thank you.
Thank you, Chief Poirier, for the overview of the annual report. We appreciate it. We do have a delegation, but before we get to the delegation, we will read the two motions on the record to make sure the delegate is aware and for members of the committee. So first, we're going to pull up actually, if we could pull up Councillor Kelly's motion first, that would be appreciated. So Councillor Kelly, if you could just introduce the motion.
Sure. Speak to it later.
I'm sorry?
Do I speak to it later, or do you want me to do that now?
No, just introduce it now,
Okay,
and then
sure.
if you want to speak to it, I can recognize you first when we get there.
Okay, thank you very much, Mr. Chair. Whereas more than 80% of Ottawa landmass is rural, and whereas rural communities experience different challenges and are often further from medical services, and whereas a fulsome understanding of the differences in response times could lead to better insights on how to address these differences, therefore be it resolved that the Ottawa Paramedic Service annual report format be improved to include a comparison of the response times in dense and low density areas in Ottawa. Be it further resolved that Ottawa Paramedic Service provide the response time performances of high density and low density areas in Ottawa for the past 5 years to support discussions in the area at the rural side.
Okay, thank you, Councillor, for moving that motion. We'll get to discussion in a few minutes. Colleagues, I'm going to move a motion as well with respect to the offload delay. It's a two-page motion. I'm not going to read it. I'll just summarize for you that it does address offload delays. It talks about, acknowledges the strategies that our chief and his staff have utilized to date. It discusses the letters that former Mayor Watson wrote to the Minister of Health in 2019, 2020, and 2022. Motion talks about last year's approval of the 2024-2026 investment plan in the paramedic services. And it acknowledges meetings that have been held to date with between the Mayor's office and the Ministry of Health and the Ottawa Hospital. And the Ottawa Hospital has identified a $4.5 million investment for more nurses and beds to help specifically address the offload delay challenge. The motion acknowledges funding that the province has provided to date. We do want to acknowledge that and appreciate that, but the fact is that the level 0 numbers are still very, very high. And there's a direct correlation, in my opinion, between level zeros, the level 0 incidents and the offloading delays that we're experiencing. So I will read the therefore clause that Council requests the Mayor on behalf of Council write to the Minister of Health of Ontario requesting that the Ministry implement solutions to immediately address the issue of offload delays in hospitals, and requesting that the Ministry provide an update on the request for an additional $4.5 million for the dedicated offload nurse program at the Ottawa Hospital to address offload delays. So we will get to that motion as well after the delegation. So thank you for that. And now I'll call upon Ms. Calla Barnett once again, who has registered to speak to this annual report. And I see you, Ms. Barnett. Welcome back.
Thank you.
5 minutes again, and the floor is yours.
Thank you for letting me speak twice today. It's a big deal. I wanted to just take a moment and recognize how difficult the job of the paramedics is, especially in my ward. I can't even imagine, as a resident living here, I'm traumatized every day, and they would drive into it. So thank you. I need to address things more on a structural level than on the ground. There was a real lack of information, lack of documentation prior to this meeting today. I don't know what the risks that you've identified are. All it said in the summary was that that there were risks and that they've been evaluated. So we don't know what the risks are for you guys. Like, we don't have that information as residents. We also are feeling increasingly unsafe and sometimes abandoned by the city in general in this ward. A lot of that has to do with the lack of response after we call 911. And I have solutions for that, and it's usually paramedic solutions. So bear with me, okay? It's my understanding that you've received 15,000 overdose calls this year in 2023. 15,000. That's wild. And I know not everybody calls the paramedics when they overdose. So there's more. I would like to know how many of those were in wards 12, 13, and 14. How many were in Sandy Hill and Lower Town? Did it impact response time of other calls? Like, are more people dying in these wards of other causes because of the overdose response? Like, I really need to know these things. Like, the residents here are scared that they're gonna die because there's not enough paramedics to respond to the overdose crisis. And we have seniors, we have people with disabilities, we have people who are immigrants who don't understand systems. Like, it's hard, it's scary. When it comes to things like the targeted diversion engagement program, love it, love the idea. I'm scared though, because OICH and Shepherds of Good Hope typically misinform or insult or abuse residents. They've called us NIMBYs behind our backs and to our faces. They refuse to engage with us in good faith. And so when you've said that they're providing safer supply, I don't know if that's true or not. Are they providing safer supply to their clients? Or are they providing Suboxone to their clients? And did they tell you that? Because they tell us they don't. Like, there's so many questions that I have. And I want to I just also note, safer supply is actually now called prescribed alternatives because 8 milligrams of hydromorphone is not safe. So there's that. Okay, moving on from that though, there's incredible programs here. The mental health and well-being response, the mental well-being response team. Mwah, love it. Community paramedics, love it. I would love paramedics on bicycles in the downtown core in my community. That would be amazing, right? It would respond to a need that we have here. The mental health team though, my understanding is that it's not a 24/7 service. And we need it to be here. We need people who are willing to engage with people with substance use disorder, or people suffering from homelessness, or people having a mental health crisis in the middle of the street in order to help them and take them out of the community and get them somewhere safe for them and for us. We don't have that. We just have non-response. We have a 911 dispatch that won't send police. They don't send anybody. They don't listen. And we need this mental health team 24/7. We need it in Ward 12 when we need it right away. We don't have anything. And $3 million was diverted from the police budget to a different budget. Thank you. To fund a similar team run out of service providers in Centertown. $3 million. And we could have something similar run out of paramedics, run out of the city that is responsive for everybody instead of just one neighborhood. I don't understand how these decisions get made. I don't understand how we get left to the side, because please, like, I'm begging here. We need this service. We need it fast. People are suffering. Residents are suffering. People with lived experiences are suffering. We need more mental health response in our area, and we need it to come from the paramedics. Thank you.
Thank you very much for your delegation today. Very important to hear from you. Any questions for our delegate? Conseiller Plante.
Yes.
I'm going to try that again. Oh, okay. Yes, thank you so much, Kala, for your delegation, and thank you for doing both fire and paramedics. I was just wondering, I know I'm not going to say where you live, but I know you sort of lived near a hot spot, a very hot spot for a long time. I was wondering if and we're not trying to say it's bad or it's good or whatever, but the constant presence of fire, ambulance, et cetera, was stressful for you as a resident who had to hear these sounds all the time.
Yeah, I mean, obviously it was. It would wake us up in the middle of the night. I was always a little bit scared that it would be somebody I know. But it was always kind of like, we couldn't even get around a lot of the time. People couldn't drive home. My child would be afraid because they didn't know what was happening, right? I don't live there anymore. I had to move. But I lived between Daly and between King Edward and Cumberland for 7.5 years. And it was perfectly manageable until 2018, and then it wasn't. And I moved 2 years ago. So, because it was a risk to my child. And I mean, like, I've had to sit in ambulances and wait for people who are overdosing to get to the hospital before me because I wasn't going to die, even though I was in excruciating pain. So that's the kind of trade-off we make here. But yeah, thanks for the question.
Thank you, and I enjoy your blue headphones too. Thank you.
Thank you, Councillor, and thank you, Ms. Barnett, for your delegation today. It's appreciated. Thank you. Okay, I was wondering if I could ask the acting GM and/or the chief just to comment. There's 2 motions that have been read in. If you could comment on the Kelly and Brockington motions, that would be appreciated for the committee.
Thank you, Chair. Actually, I'll pass it over to my colleague in paramedics.
Thank you, Chair. 2 motions before us. The second motion, the Ottawa Paramedic Service doesn't see any issue in terms of the therefore. The province has not responded to requests in terms of what was requested a year ago, and that is in regard to the 17 paramedics be funded 100% by the province to address the offload delay issue. So that motion is germane. The second motion, or the first motion that was presented by Councillor Kelly, quite honestly, I think we'd need some time to review the content to determine what is low and high density, and that we would have to work through the data to be able to provide that information, but we're prepared to work with the councillor on that motion.
Okay, thank you for those comments. Councillor Plante, your hand is up. Do you want to speak first?
Yeah, is this time for questions?
Yes.
Yep, okay, thank you. I just have a couple questions, similar to what Kala talked about, but I guess super particular to my ward, as these things often are. First question, because I always ask this, do you know how many babies were delivered by paramedics this year? It's not mentioned in your report, and I think this is very pertinent information I should know.
Quite honestly, Councillor, I should know the answer as well, and I don't. We'll report back to you on that.
I appreciate it. And genders, please.
Will do.
Thank you. Okay, so I do want to sort of, because I know my staff had sort of followed up by email, but there was 15,000 responses to overdoses by the paramedics in Ottawa in this year, or well, 2023. Approximating $1,500 a response, more or less. I'm sure it's sometimes more, sometimes less. My calculation had us spending about $22 million on responses to overdoses. Is that fair, would you say?
Chair, the first item of 15,000, the way the old dispatch system worked, the dispatch priority card index system, it coupled together mental health and overdoses. So it was an amalgamation of several different dispatch types for us. So to say that that's exclusively overdose is not necessarily correct.
Accurate,
So just
yep.
that first part. The second part in terms of costing, that number I'd say, depending on how you want to cost it, from a global perspective, if you were to use the number of incidents that the Ottawa Paramedic Service attended based on our global budget, you wouldn't be far off.
Wow.
But if we were to assess it based on an individual response, according to the bylaw that already has that we charge third parties. So say a paramedic attends an event at CTC, I think we charge around almost $300 an hour per individual. So that's kind of a different number that we could use. So I'm cautious about the actual ultimate cost of what an overdose costs to the city, and I apologize for kind of answering it in two different ways.
No, I appreciate that, but that's still a staggering amount of, if we are close to that number, that's still a staggering amount of money. And I'm just wondering as a counselor, how I can better help you guys advocate either for more money or more services or more staff. Like I really feel really helpless here. So, I mean, we can follow up maybe later on email, but it's a lot of money. Okay, and on page 21, I'm just gonna go there myself. You mentioned the program, the targeted engagement TED diversion program, which you also talked about. I was just wondering who pays for this program. Does the paramedic service, it's the one you talked about, the Shepherds of Good Hope, Ottawa Inner City Health, where, patients are diverted to, I believe, Shepherds. Who pays for that program?
To the best of my knowledge, we pay for a portion, as in our regular operations, and that the other parts are the cooperative arrangement between Inner City Health and TOH, who would actually deal with the individual at the facility.
Okay, so the patients are diverted and then treated at Shepherds of Good Hope, correct?
That's correct.
Okay. All right, my next question is page 6 about and you didn't talk about it, but I actually found it quite fascinating, the paramedics on bikes. Oh, sorry, I didn't know if he was on the page. Sorry about that. Yeah, I was just wondering, what is this mainly used for? Is it sort of like when there's a big game at Lansdowne and then people are on bikes? Like when is this deployed? I don't think I've ever seen this in the market.
Through the chair, the paramedic bike unit was held in abeyance during pandemic.
Okay.
And that was something that was an appropriate action to take. This year, we brought back the paramedic bike team, and they'll be at the Escapade this weekend. They'll be at Canada Day. They were at race weekend. So they're both providing medical assistance, but they're also part of usually large gatherings of individuals to provide a service where vehicles may not be able to access a patient as easily.
Well, just one of the reasons I was told I couldn't pedestrianize the Byward Market for Canada Day was because they said paramedics need to have access, but had I known that they were on bikes, it would have been helpful to sort of better articulate why we were able to do that. So I appreciate that, and it helps me advocate for more bike lanes. So I appreciate this very much, and if I could get more information on this program, I would very, very much appreciate it, because we have Panda, we have St. Patrick, like there's just a lot of big gatherings where I think this could be really, really helpful, and I'd like some more information offside if you have some. And then last on page 28, just gonna go down there. I had asked this question when we voted at Community Services for the alternate response. And if you remember at the time too, the Ottawa Hospital had sent a letter because they were sort of wondering why we were doing the alternative mental health response when we have the mental well-being response team already in place, and it would have been easy to scale that up. So I was just wondering, what is the difference then between this and then the new alternate response, which will be launched, I believe, in a couple months?
Through the chair, the mental wellbeing response team combines a paramedic with a social worker or a mental health worker who is part of the mobile crisis team of the Ottawa Hospital. So they work together in tandem in a separate vehicle and provide service in the community. The initiative to which I think you're referring is through the Community Safety Wellbeing Initiative. And that will be a different initiative that is earmarked for specific communities in the city, which will not have a paramedic or a crisis worker at this time, to the best of my knowledge. So there is an articulation in terms of we're there responding through the 911 system and attaching ourselves to calls, whereas the other program that's envisioned, and I use Guiding Council as the group that's been working with this as well, will have a different triggering process by which they're dispatched. And I think there's still work to be done on the actual detail and how we'll articulate between our program and this new program.
Wonderful. What does someone call to access this response? Is it 911?
The MWRT?
Yeah.
Correct. Right now, the NWRT watches the calls, so they have access to, I'll call it our computer-aided dispatch, so they can see all the calls as they are. And the calls has information as in, this is a mental health call or somebody with anxiety, and they self-attach themselves to those calls.
Okay.
Or a paramedic is on scene already with a patient, and the paramedic calls through our dispatch that group to attend. So that's kind of our process by which our team is activated. And I'm sorry, I can't speak on the actual details of how the other team will be deployed.
No, I appreciate that. I may ask to do, if they will allow a ride along at some time in the future, if they'll allow for it. I understand if they can't. Okay. But thank you very much. That's all of my questions, and I look forward to finding out how many babies were delivered. Thank you very much.
Thank you.
Merci, Conseiller Plante. Councillor Kelly, you're next.
Thank you very much, Mr. Chair, and thank you very much, Mr. Poirier, for being here today and your comments on my motion as it is right now. I do get a lot of calls, and it was an issue that popped up during the last campaign almost every day, ambulance response times in rural wards. And I know this response times and level zeros are not just a rural issue, but much like many issues that we talk about around the council table, they can sometimes be felt in a different way in the rural areas. And I've heard of very long, like hour-long, multiple hour-long waits for paramedics in rural areas. And so I want to, and I truly believe that in the mantra that if you don't measure something, it's a lot harder to change it or manage it. And so that is important to me. That's why I moved this motion today. And so I just have a couple clarifying questions on your comments. When did the city stop reporting on the difference between high density and low density response times?
Through the chair, to the best of my recollection, I think there was a change in legislation in the early mid-2000s, so 2007 to 2010 was when that change was made, that it would be a single response time globally for the community.
Okay. Not exactly confident in the timeline that you've given there, because I do have a report in front of me from 2012 from the city of Ottawa, which outlines quite clearly response times for high density and low density areas. So perhaps we could confirm that timeline, but in my opinion, the province no longer demands that we do that. So is that why we've shifted away from that?
Through the chair, that's the best of my recollection.
Okay. And I know you had mentioned that it might take time to that would be the one challenge with my motion, is understanding, or defining high versus low density. But could it be as simple as looking at what was previously considered high and low, or what the definition of that was, and just employing the same thing moving forward?
Through the chair, the old definition was the number of calls that were within a square kilometer, within 7 contiguous kilometers. There was some complicated formula, which determined a high density square kilometer versus low density. To look at your motion, we could do much more, I guess, not necessarily a sophisticated a model, but we could look at high density and low density, and we could even have that discourse or dialogue with you on what that boundary could be. So it could be Stittsville to Orleans, and whether or not Manotick is or isn't included, that kind of thing. We could, and then that would make it much easier to determine that, because the old process years back was very laborious in terms of determining high from low density.
Okay. Would it be more simple if I changed the language in the motion to rural and non-rural?
Through the chair, I'm amenable to either. If we can agree on the boundary, I think we can accommodate the request.
So I don't know if some of my suburban or urban colleagues may want to carve out different areas to measure as well, but I would be happy with rural and non-rural, but I'd be happy to make that change in the motion if my colleagues are amenable to such a change and make it a little easier for you to execute. But I do appreciate your feedback and just want to be sure. So this is, regardless of whether or not we make a change to the language, this is something you feel that you could do?
Through the chair, Councillor, absolutely willing to take a look at this. I'm interested in the data for many reasons, one of which would be the change in our dispatch protocol, which has had a significant, I think, positive impact on our ability to provide service to our rural areas of the city. So I'm interested in this information as well.
Fantastic. That's great to hear. So I will wait to hear from my colleagues on whether or not there's an appetite to change the terminology from high and low density to rural and non-rural, but for now, I'll leave it the way it is. Thank you.
All right, thank you, Councillor, for that. Councillor Luloff.
I suppose a friendly suggestion on that point. I think that we've got some pretty clear boundaries drawn through the official plan, and perhaps this data could be provided by Transect, and then you would end up getting the exact data that you're looking for with perhaps a little bit more granularity, Councillor Kelly.
Fantastic. Okay. Can you send me some language, or did you just propose specifically? I was on my way to get a glass of water, so I missed the
no
very
problem.
first part of that. Yeah.
Rather than saying rural or non-rural, you could say provide the data by Transect. That would be my suggestion. Perhaps that would provide a level of granularity to councillors in all three areas of the city, and provide you specific rural data and provide very specific lines as outlined by the official plan. Just might make life a little bit easier rather than trying to draw new boundaries and whatnot if we've already got a model in place. So
I wish I came up with that idea myself. Thank you, Councillor Luloff.
We're here to work together, my friend.
Thank you, Councillor. Do you have any further questions for staff on the report?
No, just thank you very much, Chief Poirier. Obviously the challenges persist. I think that we continue in speaking with our counterparts at the provincial level, advocating for what you've been asking for years. I want to commend you on your continued work. It seems to me that whenever we face these challenges, the Ottawa Paramedic Service steps up. You've done a wonderful job with a pilot, and then an expanded pilot, and then a blanket program when it comes to transferring patients at our local hospital. Local hospitals, you've entered into agreements with the MOL4. I know that that's bearing fruit, but it certainly isn't enough. And so, as we've said in the past, we need a dance partner if we're going to be able to solve these problems. So again, I really appreciate all of the solutions that you've come up with, and certainly need to continue that advocacy to ensure that there are hospital staff there ready to deal with these sorts of transfers. So thank you very much for your hard work. Appreciate your engagement. You're always only a phone call away, and appreciate your regular updates to members of the committee and members of the council. And thanks again for your continued hard work on taking care of the mental health of our women and men in the paramedic service.
Thank you, Councillor. Very kind words. Perhaps we could ask the committee coordinator to display Councillor Kelly's motion on the screen, just so we can, as much as I don't like doing this at committee, we will finesse the wording and get it right. Or get it better.
That kind of day, Mr. Chair.
It's okay. It's all right. What I would suggest, Councillor, as we're waiting for your motion to come up on the screen, is that the wording would be, as Councillor Lulov suggested, by transect, which is preferred. And if for whatever reason that data cannot be provided by transect, we would go rural, non-rural. That would be our second choice.
Okay, that works for me. And I've already heard from our wonderful clerk who proposed the language and should be up on the screen shortly, I believe.
All right.
The language that we have, and I believe staff is just putting that on the screen, is that the resolution be revised to say, therefore be it resolved that Ottawa Paramedic Service annual report format be improved to include the comparison of the response times by transect and the other resolution.
Okay, so staff is okay with that wording, that revision? Chief?
Yes, Chair.
Okay. So does anyone have any final comments on the annual report before I ask us to vote on the motions? Okay, if we could get the Councillor Kelly motion on the screen, that would be great. Thank you. I just want to make sure we're all clear about what we're voting on. So we're going to amend that, the wording there in the first therefore clause? So Madam City Clerk?
Perhaps a clarification from the mover, Mr. Chair, as to whether the first therefore be it resolved should also be revised to replace in dense and low density areas with by transect to match the final resolution.
I think that's the intent, but I'll yield
Yeah.
to Councillor Kelly.
Yeah, that's good. Let's do that.
And in the so in the first and in the second, we will make that same change.
But the intent, we're not going to mention high density and low density areas, right? The intent is to replace these with transect, the transects.
That is correct.
Okay. So Madam City Clerk, are we on the same page?
I'll suggest be it further resolved. Yeah, sorry, it's gone now. But to provide response times by transect, you can just finesse that one sentence.
Okay, so why don't we take a 2-minute break just to get the wording perfect, and we'll reconvene in about 2 minutes if that's okay. Okay, if I could just call us back to order. Thank you to the clerk's office for just amending the motion. Colleagues, if we could take our seats, please. And I just ask Councillor Kelly to please review the motion.
Looks good, Chair.
Okay, thank you for that. So do we have, I just want to make sure we have quorum. 3, we do, okay. So colleagues, unless there are any further questions or comments, I'll call the vote on these two matters. So we'll deal with Councillor Kelly's motion first.
Mr. Chair,
Yes.
a moment. We just took a quick look at Transect, and I'm not sure that we can comply with that. I'm willing to comply with whatever we can find as a reasonable solution. So I'm just wondering if there's a way of, and I'm not the expert on finding the right language. I understand the intent of the councillor, and I'm willing to work with the councillor to find the appropriate method to report what the information he would like. I'm just not sure that the motion as presented is something that we can manage at this time.
Because
Sorry.
because the Transect has that level of,
Our quick review
precision.
of the granularity and how it works.
so I mean, the committee is willing to note your comment, and I think that Councillor Kelly would accept sort of rural, non-rural, if the Transect data could not be provided at that precision, level of precision. I think you noted you could provide rural and non-rural, is that the case?
That's correct.
Okay.
Chair.
So as long as we all understand going into this that we'll try our best to get it by Transect, and if that's not possible, then the default will be rural, non-rural. Is that acceptable?
I will work with that, Chair.
Okay, fair enough. Councillor Kelly, that's okay with you?
That's okay with me, yes.
Okay, fair enough.
Sorry, everybody.
No, that's okay. So on Councillor Kelly's motion, all those in favor? Is that carried?
Carried.
All right, thank you. And on my motion to request that the mayor write to the Minister of Health with respect to the offload delays, is that motion carried?
Carried.
Carried.
Thank you. Okay, and thank you to Chief Poirier for your update and overview today of the annual report. We appreciate that. And of course, appreciate all individuals who serve, not just as paramedics as well, but those who provide support to the Ottawa Paramedic Service. This is not an easy job. It is both physically demanding and psychologically demanding, and we sincerely appreciate particularly everyone who works in the service. So my strong appreciation to them. Okay, continuing with our agenda, any in-camera items? There are no in-camera items, excuse me. Notices of motion. Did we receive the annual report? Did I already call that question? We'll do it again, just in case. So receive the 2023 annual report of the Ottawa Paramedic Service. Is that report received?
Received.
All right, thank you. Thank you, Councillor Johnson. There are no in-camera items. Notices of motion. I don't believe there are any, but just pan my colleagues. No, okay. And there is an inquiry from Councillor Kavanagh. Now, does this have to be read by a committee member? Bradley, okay. Councillor Bradley, you're going to read the inquiry on behalf of Councillor Kavanagh.
Sure, and I'm happy just to introduce it, and if Councillor Kavanagh wants to read it, that's fine. I know that it is her inquiry. Is that allowed, or am I to read it?
You please go ahead, Councillor Bradley.
Sure. Okay, so on behalf of Councillor Kavanagh, in June of 2023, Council approved the report on demand accessible taxi cab service study and minor amendments to vehicle for hire bylaw related to taxi cabs. This report approved an annual incentive grant on a 3-year pilot basis with the goal of ultimately improving service for the community of people with disabilities who are reliant on this service. Can staff please provide responses to the below questions following an analysis of 6 months of data, April 2024 to September 2024? 1, how many accessible taxis are now licensed? What percentage of these are new since Council received this report? 2, currently on average, how many hours are accessible taxis on call for private hire versus contracted by Paratranspo? 3. In comparison to previous years, has the number of hours of accessible taxis on call for private hire gone up, down, or stayed the same? 4. Can committee and council expect any interim evaluations and reports on the efficacy of this pilot? 5. What specific benchmarks will staff be looking for to evaluate this pilot?
Thank you for that. And just to be clear, you want data from April to September 2023 or 2024? It says 2024.
I'll defer to Councillor Kavanaugh on that.
I think maybe that was meant to be 2023.
Right. We're not in September yet, so just to change the data set, April to September 2023. Okay, thank you, Councillor Bradley, for reading that inquiry. Any other inquiries?
Mr. Chair, if I may,
Yes.
I was consulting with Mr. Chapman, Director Chapman. I think it should be 2024.
Okay,
Okay, it is 2024.
I apologize. Thank you. Thank you. Thanks for that clarification. Okay, is there any other business? Seeing none, I'll just note that our next meeting will be September the 19th. At that meeting, we expect 2 reports stemming from the bylaw review work plan. The first will be on snow plow contractor licensing, and the second will be on the idling control bylaw. So that will be at our September meeting. Wish everyone a fantastic and safe summer. Given that there's no other business before us, our meeting today is adjourned. Thank you.
Thank you, Chair.